Let's now assume that you want to change some of the information in the program. Press the Run Pause button. Press the Yes Enter button to confirm Resume. Press the No Change button to review the program. Use the arrow button to advance the highlighted bar to the variable you would like to change. If the variable you'd like to change is on the second page, arrow down to Next and hit the Yes Enter button. Press the No Change button to erase the current information and then enter the new amount. Press the Yes Enter button to confirm the new setting. Continue to press the Yes Enter button to confirm and advance through the program until you reach the Done prompt. Confirm by pressing the Yes Enter button to return to the Run screen. To restart the infusion, press the Run Pause button. Once the infusion is complete, the pump will alarm and Infusion Complete will flash on the screen. To silence this alarm, press the Silence button. If you would like to record your total information for the bag, do it at this time. When you repeat the program, it will clear all the current prescription infusion amounts on the screen. The shift totals and hourly totals will remain when reviewed using options. We have gone over programming a new program, changing the program and hanging a new bag, and using the same prescription. Everything else you would like to do with the pump is found on the Options menu. Let's assume that you want to give a clinician bolus. Note that the pump does not have to be paused to give a clinician dose. First, press the Help Options button to pull up the Options menu. Use the down arrow button to highlight the clinician dose feature. The feature will read Off, and you want to press the No Change button to change Off to On. Press the Yes Enter button to confirm On and enter the clinician dose feature. Enter the clinician dose amount, then press Yes Enter. Press Yes Enter again to confirm and exit the feature. Press the Yes Enter button to confirm the Accept option. The clinician dose will be administered at this time. When the clinician dose is being administered, it will show the amount being given and the bar graph will advance as the dose is being administered. The pump will beep when the dose is complete. If a clinician dose is to be stopped, use Pause, edit to 0 and restart. If a lock level is programmed, it will ask for a code. Use the lock code you entered for security purposes in order to program the clinician dose. Let's now check and clear our shift totals. Once again, that is found in the Options menu. Before you enter and clear the shift totals, record the remaining volume in milliliters from the main screen. Press the Help Options button to enter the option menu. Use the down arrow button to highlight the shift total feature. The feature will read Off, and you want to press the No Change button to change Off to On. Press the Yes Enter button to confirm On, and enter the shift total feature. Review the information and record your data. The information on the screen will be volume infused, clinician dose, amount infused, bolus given and attempted. To clear the information, press the No Change button to change Exit to Clear. The Done line will flash and indicate Clear next to Done. Press the Yes Enter button to clear the information. The screen will show that the fields are now at 0. Press the Yes Enter button to exit the feature. Press the Yes Enter button to accept options as it scrolls all options and returns to the Run screen. To view the features on the Options menu, select Help option. The following features will be shown as the down arrow is pressed: lock level, clinician dose, shift totals, hourly totals, clear hourly totals, downstream occlusion setting, air sensitivity setting, audio alarm level, and power check. At the end of scrolling, you will be at the Accept Options prompt. Select Yes Enter to accept changes or No Change button to leave without making any changes. Consult the operator's manual for details on the lock levels. We have already described clinician dose and checking and clearing shift and hourly totals. Hourly totals will show you a 24-hour running total of the total infused, amount given, bolus given, and bolus attempted. The downstream occlusion pressure setting is defaulted to low. If you are getting nuisance occlusion alarms, then you may want to change the low limit to high. You would change this by pressing the No Change button to change low to high and then the Yes Enter button to accept the setting. On the next line, the pump has an air-in-line sensor that is defaulted to 0.5 milliliters. Pressing the No Change button allows you to incrementally change the sensor setting from 0.1 milliliters, 0.5 milliliters, 2.0 milliliters, and to off. Select the proper value and press Yes Enter to accept the change. The audio line displays the volume level between 1 and 9. To change, press the No Change button and enter a number between 1 and 9 using the numeric keypad. The pump will beep once. Then press Yes Enter to accept the volume level. If your pump has been set up to deliver continuous infusions, when administering some antibiotics for example, this is how you would create a new program for the continuous mode. With the program line highlighted, press Yes Enter. Select the unit. ml will be flashing. If this is the desired unit, press the Yes Enter button. If not, press the No Change button to change the unit to mg, or again to mcg or ml. Once the desired unit is showing, press the Yes Enter button to advance in the menu. For this program, we are going to use ml. Press the No Change button to add a delay time to the therapy, or press the Yes Enter button to accept the default delay, which is off. The titrate feature allows maximum rates to be programmed as a safety measure. Press the No Change button to use the titrate mode in the therapy. Press the Yes Enter button to accept the default, which is off. Press the Yes Enter button to advance to the next screen to begin entering prescription information. Use the numeric keys to enter the total bag volume that you are hanging on the patient. Enter the amount of the total volume that you wish to infuse into the patient. Enter the rate of infusion as a value in milliliters per hour. Note that the pump cannot be programmed to infuse at a rate higher than 400 milliliters per hour. Enter the desired rate using the numeric keys. If titrate limits were on, this value could be less. Based on the volume to be infused and the rate entered, the pump will automatically calculate the total time of infusion in hours and minutes, and this time will be highlighted and flashing in black bold. Press Yes to accept the total time of infusion. If you select No, the display clears and you can enter an alternate time. Once entered, this time will be used to recalculate the rate, which will flash above in the rate line. Press the Yes Enter button to confirm the new rate and time. The Keep Vein Open rate is used to maintain an open line to the patient by using a very low flow rate from the pump. The default rate is 0.1 milliliters per hour. Press the Yes Enter button to accept the KVO rate. Press the Yes Enter button to complete programming, and then start the infusion using the Run button. If your pump has been set up to deliver total parenteral nutrition infusions when administering TPN therapy, this is how you would create a new program for the TPN mode. With the program line highlighted, press the Yes Enter button to begin programming a TPN therapy. The first line prompted is the delay line. The clock on the pump must have the current date and time set before using delay mode. The date and time are set in the Biomed Options menu. Press the No Change button to activate the delay. Press Yes Enter again. Enter a delay time in hours and minutes. Press the Yes Enter button to accept the time. Enter no more than 24 hours from the current date to begin infusion using the numeric keypad as month, day, and year, with 2 digits for the current date. Press Yes to accept the date, and Yes again to accept all date and time parameters. Use the numeric keys to enter the total bag volume that you are hanging on the patient. Enter the amount of the total volume that you wish to infuse into the patient. Skip infusion rate with the down arrow. Enter the time in hours and minutes when you want to begin a gradual increase in the rate of infusion to administer the TPN solution to the patient. Press Yes to accept. Enter the time in hours and minutes when you want to begin a gradual decrease in the rate of infusion to reduce delivery of the TPN solution to the patient. Press Yes to accept. Enter total amount of time for infusion. Press Yes to confirm and calculate the rate. The rate is auto-calculated and highlighted with the cursor. Press the Yes Enter button on the rate and ramp fields to accept. The Keep Vein Open rate is used to maintain an open line to the patient by using a very low flow rate from the pump. The default rate is 0.1 milliliters per hour. Press the Yes Enter button to accept the KVO rate. Press the Yes Enter button to complete programming and then start the infusion using the Run button. A few tips on solving common alarm problems. If you obtain an error in line alarm, pause the pump. Press Yes to resume. You will be taken to the Run Prime screen. Disconnect the line from the patient. Press the Prime button to move the air through the pumping mechanism and remove all air from the line. Press Yes to return to the Run screen and press Run to resume the infusion. If you obtain frequent downstream occlusion alarms, you can change the sensitivity setting in the Help Options menu. Press the Help Options button and use the down arrow to move the highlighted bar to the down occlusion line. Change low to high by pressing the No Change button, and then confirm the change by pressing the Yes button. Continue pressing the Yes Enter button until you reach the Accept Option line. Press the Yes Enter button to accept the option change. Upstream occlusion alarms usually occur when the bag has run dry. To silence this alarm, press the Pause button and check the bag. If you need a new bag, replace the bag. Use the down arrow to highlight the Repeat RX line and press Yes Enter. Hit Yes again. The pump will slowly scroll through the program so it can be reviewed. Hit Yes again. Press Run to start the infusion again.